Hi, my name is Egbe Franca from Cameroon. I am a We 54 African leader. We 54 is an unconventional social movement which aims to transform Africa by harnessing the potential of every young African to contribute to the sustainable development goals in actionable ways. Today, I'm going to talk about coronavirus. As we all know, coronavirus is affecting people around the world, it's all over. Coronavirus is an infection disease caused by a newly discovered coronavirus, and it affects people in different ways. Due to coronavirus, as this disease has brought in so many misconceptions of people, especially for Cameroonians, and this misconception or misinformation has led to so many deaths, and people are still dying because they are misinformed about the whole coronavirus stuff. So today I'm going to talk about the five misconceptions Cameroonians have about this deadly pandemic coronavirus. Firstly, the first misconceptions Cameroonians have is, according to Cameroonians, coronavirus does not exist. They see it as a scam for the government to make money, maybe from the World Health Organization, United Nations, support from donors, international donors, and support from in and out of the country. They see it as a way for the government to make money. But I'm here to say that's not true, because Cameroon itself is undergoing a crisis, the Anglophone crisis, and the government has wasted so much money on that, and it's still ongoing. And I don't see coronavirus as a way for them to make money. Coronavirus is real. I'm here to tell you people that coronavirus is real. Also, Cameroonians, according to them, coronavirus does not affect the black human race. That's not true. They say coronavirus does not affect people from humid, hot climate. But I want to tell people that I know of somebody who died of coronavirus in Limbe, southwest region of Cameroon. He died of coronavirus. He's not a white. He does not live abroad. He lives in Cameroon. He's a black. He's a Cameroonian and an African, like every other person. So coronavirus is real. Secondly, the people of Cameroon, they have this misconception that coronavirus can be cured by our local herbs, our local Cameroon herbs. For example, we have garlic. They say garlic can cure coronavirus. Fever grass, also known as tea leaf in Cameroon, and also bitter leaf. They believe coronavirus can be cured by these local herbs, and this has made people with mild symptoms of coronavirus to stay at home and administering these drugs, these local herbs, in the name of curing or preventing coronavirus. And when the cases are severe, when the symptoms are severe, they rush now to the hospital, which will lead to death, or maybe will lead them to a more critical condition. I'm here to advise people, if you know you have my symptoms, or maybe relating to coronavirus or not coronavirus, go to your nearest regional hospital, clinic, and get tested. Take proper medical advice and proper medical treatment. Thirdly, Cameroonians believe that COVID-19 can be cured and can be prevented by the excess intake of marijuana and alcohol. This is so funny. I've never heard about that, but I don't know. I don't know who came about that, but for me, marijuana helps to destroy our lungs and our other organs, other parts in our body, our organs. So I don't know, alcohol is not good for our health, talk less of marijuana. So I want to tell people to stop taking all these things and stop deceiving and some misinforming people about COVID being cured by marijuana and and alcohol. There's no cure for COVID-19 as of now, and I will discuss the main measures that has been taken in place by the World Health Organization to avoid this disease. So please, coronavirus is not cured or is not prevented by the excess intake of marijuana and alcohol. Fourthly, Cameroonians believe antibiotics can cure and can prevent coronavirus. This is not true. Antibiotics is used to treat bacteria. Antibiotics cannot be used to treat viruses. And COVID-19 is a virus. So people should stop taking different type of antibiotics in the name of preventing or curing COVID-19, whether you have normal flu or flu relating to COVID-19. In a long run, all these things we have been taking so far, it will destroy our organs, destroy several things in our body system. So we should please avoid all these things and take the measures that has been put in place by the World Health Organization to prevent these things. Lastly, Cameroonians believe COVID-19 cannot affect the younger population. They see it like coronavirus mostly affect mostly the elderly. I want to tell people that there's no class distinction in coronavirus. There's no age distinction. There's no race distinction. Coronavirus affects people from everywhere, be it an albino, a white, a black, a short, a tall, a fat, and a thin human being. Coronavirus affects everybody. It's left for us to prevent it, and the World Health Organization has put in place several measures. So far, there's no treatment and no vaccine for coronavirus, but treatments are under investigation and which should be passed through the clinical trials, tested through the clinical trials. So for now, there's some few measures that have been put in place for us to follow, which is, the first one is to respect social distancing. That's the first and the most important. The second is our regular washing of hands. Your hand sanitizer must always be with you. Always wash your hands with soap after a few minutes. Thirdly, put on your face masks whenever you go, whenever you want to enter a taxi, whenever you want to go to a crowded environment, be it the market, the church, your job site, etc., many others. And lastly, our hygienic conditions. We need to be improved on our hygienic conditions. We need to take self-care. We need to be clean in and out to prevent this thing. And lastly, be safe and be alert. Coronavirus is a reality, and we have to accept it and deal with it by taking these measures put in place. We should stop misinforming people and stop creating our own conception within our minds that coronavirus can be cured by maybe one or two things. We should take these measures that have been put in place by the World Health Organization to reduce and to prevent this deadly pandemic until when cure comes. But for now, coronavirus is real, and we need to be alert and stay safe. Thank you.